Hello and welcome, everybody. Thank you very much for tuning in. I am Lucas Tietzen, and this is Blues News Media. And today we have quite the doozy for you. It is probably one of the biggest displays of propaganda that I have seen in my life so far. And just jumping right into it, this is from Bloomberg. You all remember Michael Bloomberg. He tried to buy the presidential seat and quickly dropped out, but he is still doing his part for the New World Order in pushing propaganda. And this piece right here really made me want to vomit several times throughout, and it is titled, "Forced Isolation May Be the Only Way to Stop Resurgence of Virus." And if that doesn't sound like the Orwellian dystopian world that is in store for all of us, I don't know what does. But before we start reading this article in its entirety, I want to please remind everybody to like, share, subscribe to this video and this channel. Anything and everything that you can do to help support us, we greatly appreciate. And more than anything, we just want to get this word out. And as always, I'm going to have everything linked up in the show notes for your reading pleasure. But with that out of the way, let's see the beautiful world that Bloomberg has in store for us. And this article opens with, "Flare-ups from Australia to Japan show the world hasn't learned an early lesson from the coronavirus crisis. To stop the spread, those with mild or symptom-free coronavirus infections must be forced to isolate, both from their communities and their family." Let's read that again. They need to be forced to isolate. You need to be removed from your community, from your neighborhood, and your family. And we already know that this was a goal of power for quite some time. The World Health Organization has stated before that an unintended consequence of the lockdowns, it pushed transmission from the street into the home, and that the only way to curb that was to remove infected people from the house. That's right, your kids got the cough or the sniffles, they may have tested positive for the virus. Well, guess what? The CDC is going to be at your doorstep, or whoever the hell is going to be enforcing these draconian orders, taking your child away and put into isolation. But don't worry, they'll be around a bunch of other sick people monitored by God knows who, and you'll get them back in about 14 days, of course, unless they test them and they still test positive, which we already know that people testing positive for the coronavirus are actually just showing, more often than not, dead cells in their tests. But hey, trust us, you'll see your kid again. But I mean, that just right off the bat is quite the doozy of the first paragraph. But it continues with, "In Australia, where Victoria's state has been reporting record deaths, some 3,000 checks last month on people who should have been isolating at home found 800 were out and about." Oh no, they were living their lives. "In Japan, where the virus has roared back, people are staying home but aren't in isolation. 40% of the elderly patients are getting sick from family members in the same apartments. Hence the need for ripping people out of the home, the family unit. The failure to effectively manage contagious people with mild or no symptoms is a driving factor behind some of the world's worst resurgences. But lessons from Italy, South Korea, and others have successfully contained large-scale outbreaks show that there's a tried and tested approach to cutting off transmission. Move them out of their homes into centralized facilities while they get over their infections, which usually doesn't require longer than a few weeks." I mean, I don't know about you. I mean, I could just be ripped from my home at any point in time, gone for 2 weeks, and yeah, I'll still be able to afford rent. I'll still have my job. Of course, this is not actually the case, and I doubt the majority of the population could not keep up with these crazy terms. I mean, who in the hell could just take off 2 weeks and have their job waiting for them? The answer is damn near nobody. It is going to just completely crush people, not to mention psychologically horrify them, especially children. And I just think it's honestly insane because though they're saying that mild and no symptom people are the ones really, really spreading this virus, we've reported on it before that transmission of people with little to no symptoms do not transmit this disease that easily, at least not as easily as we originally anticipated. Remember years ago back in March when all of this was kicking off and it seemed like it was the super bug that was going to end humanity. Turns out it wasn't, and the World Health Organization has admitted itself that it does not transmit easily from person to person or even from surface to person. This thing does not travel easily. And I think it's funny because out of the Daily Mail, they just reported this, that nearly 3/4 of coronavirus infected people have no symptoms on the day they are tested for the disease. The government data reveals, as much as you can trust the government. But many of these people are already just not showing symptoms. So in this great dystopian future that is coming our way, many people are going to be just thrown into camps, into facilities. Who knows? I mean, you remember when everybody was building up these hospitals to try to make sure that the medical system didn't collapse. Maybe it wasn't originally intended for the first wave, but the second one, where they know that a lot of people are going to be asymptomatic and need to be removed from their homes. They're going to need a lot of space to isolate these people. What if those fill up? We all remember the FEMA camp conspiracy, right? But hey, that's just conspiracy theory. I'm sure that won't come into play at all later on down the line. But continuing, it says, a laissez-faire approach, naively trusting everyone to be responsible, has been shown to be ineffective, as there will always be a proportion who will breach the terms of isolation, or, as I like to call it, people out there living their lives rejecting government mandates. But this was said by Jeremy Lim, an adjunct professor at the National University of Singapore's Saw Sway Hock School of Public Health. I hope I pronounced that right. Continues. Faced with a new cluster this week after 102 days without a locally transmitted case, New Zealand has quickly enacted the strategy, placing around 30 people, including at least 2 children below the age of 10, into centralized quarantine camps. But other countries facing sustained spread like Australia and the United States are not broadly enacting the policy despite its proven track record. Nuts to your track record. Their unwillingness or inability to do so underscores the challenges faced by liberal democracies whose populations are less likely to tolerate measures that require individual sacrifice for the greater good. I don't know about you guys. I have a daughter. She's under the age of 10. If she was ripped from the home and pushed into a centralized quarantine facility, or as I want to call them, camps, they're camps, she would be traumatized. This is not normal. I don't care if it's for the greater good. There is a thing called basic human dignity. I don't care about the greater good if it means you rip my child away from me. That's messed up. That's twisted. This has been a decades-long psychological attack that you don't own your body. The government does. The government will mandate when and where you will go and at what time. This is scary. But I like how we all have to sacrifice our basic freedoms for the greater good, even though this has been shown to have a very, very low mortality rate. I believe it was 0.6%, the World Health Organization stated. And in the same press release, they mentioned that it could actually be lower because, I mean, they haven't implemented their total global surveillance system, so they can't know about every single case. But we can presume it's lower than that. I'm supposed to have my child ripped from me and sacrifice my future and her future and our rights because of a very, very small portion of the population has a very, very small chance of dying, just doesn't add up. And I don't think anybody should consent. We need to fight this. You can't just have people come in your door and take you or your loved ones away. When and where will it end? Then it has not at home. The existence of a large group of carriers who hardly feel sick is a unique feature of the coronavirus crisis and a major factor that has driven its rapid spread across the globe. Unlike in previous outbreaks, like the 2003 SARS epidemic, many infected people don't feel ill enough to stay home, and so spread the pathogen widely as they go about their daily lives. The United States Center for Disease Control and Prevention has estimated that 40% of COVID-19 infections are asymptomatic, even though we have others stating that it's, at least when they're tested, 75%. In Wuhan, the Chinese city where the coronavirus first emerged last year, mildly sick patients were originally turned away from hospitals and told to rest at home, given that the overwhelmed healthcare system needed to tend to the most severe cases. But health experts soon found that these people would infect their family members and others as they moved around in the community, precipitating a deluge of cases. Bringing mild or asymptomatic patients to designated facilities, repurposed convention centers, hotels, and stadiums for basic medical care marked a turning point in the city's fight against the coronavirus. Simply separating them from healthy people halted the pathogen's silent spread through the community. Certainly, you all remember back when this was really kicking off, the people, especially in China, the videos of people in full PPE literally breaking into people's houses and ripping them out of their homes as they're kicking, they're screaming, they're crying, they don't want to go. Not only is it a traumatizing experience, but I'm sure the people of China are not ignorant to the fact that they are suffering under a very oppressive totalitarian government, much like the United States and all around the world. This is scary. To support this is maddening. I can't see how anybody would gladly march along to the nearest isolation center. But I'm sure there's going to be a big push, a big propaganda push to public relations, that's the word, push to get people to just smilingly give up their rights and go to these facilities. The strategy has since been used in Italy, Singapore, and South Korea at the height of their own coronavirus outbreaks earlier this year. Faced with the resurgence last month, Hong Kong converted an exhibition center to accommodate mild COVID-19 patients and is building more such facilities. In New Zealand, the government put a lot of thought into enacting the policy and is asking family members of confirmed cases to go into centralized quarantine with them if they require care, said Director General of Health Ashley Bloomfield. The approach is effective firstly because it prevents people from infecting family members in the same household, much like the World Health Organization guy mentioned. Over 80% of cluster infections in China cities were in households after mild patients were allowed to stay home, said a Lancet study. In Europe, the surge of household infections drove Italy's Milan to start putting such cases in hotels, enabling the country to gain control over its outbreak in early May. Beyond household spread, the strategy is necessitated by a facet of human nature that's been seen time and again across countries and cultures. left to their own devices, some people just won't follow the rules. Some people, I like to say, revise this, just won't submit to authority. And that is why we need to show them the way, enlighten them. We need to do the thinking for them. And that starts with, of course, ripping them out of their houses, away from their families and support units, and putting them in isolation, care facilities, I'm sure they're going to call them. They're going to spruce up the language when it's all rolled out. But it continues. In Australia and Japan, infected people who've been told to stay home have gone out for a variety of reasons. Some can't work from home and need the income, like many, many people, while others want to pick up groceries and supplies. One woman in Tokyo traveled across country by bus after having her infection confirmed. It is far better to be more aggressive in the short term with even mild cases than it is to allow such cases to slip under the radar, said Nicholas Thomas, associate professor in health security at the City University of Hong Kong, and I would say a supporter of authoritarian rule. Locked up. But forcibly moving mild or asymptomatic patients into centralized facilities has been met with backlash in some countries where citizens are not as accepting of government directives. You don't say. Some people might lose their jobs if they disappear for 2 weeks, or have caretaking responsibilities for young children or older parents where it's unfeasible to be separated. Yeah, who would have thought? People don't trust the government and don't want them ruling their lives to the extent that they rip them out of their homes, and they have families, they have people to take care of. But naturally, this is all hoo-ha mumbo-jumbo, I'm sure. People would be wondering what on earth they're doing locked up in a hospital, said Stephen Leader, emeritus professor of public health and community medicine at the University of Sydney. From what I know about the Australian psyche, I don't think it would go down all that well. I would say that's the human psyche, sir, not specific to the Australian mind. In places like Venezuela and India, where conditions in quarantine facilities are poor, the prospect of being taken away has caused some to avoid being tested or to lie to contact tracers for fear of being found positive, making the work of health officials more challenging. I'm not saying lie to your contact tracers, but I am saying they have no right. Just putting that out there. In an emailed response to Bloomberg News queries, the Department of Health and Human Services in Victoria said the government provides alternative accommodations for quarantine, but that these are for health workers who may not be able to safely live at their normal address and other vulnerable groups. Rather than forcing isolation on mild cases, authorities have locked down 5 million residents in Melbourne and are tightening restrictions until new cases come under control, which is when they say so. We'll let you go when we say so. But until then, we're just going to lock up 5 million people. I mean, 2019 was a golden year compared to this. This is power rearing its ugly head and showing you the future if something is not done. To close it out, officials are using a combination of stepped up checks and fines of 957 Australian dollars or 3,550 American dollars to convince affected people to stay home, while repeat offenders risk a Australian dollars $20,000 penalty in court. More than 500 military personnel are helping the police conduct checks on 4,000 households every day to ensure those who are supposed to be staying home are there. I mean, if that doesn't scream military rule, I don't know what is. I guess martial law is technically, rule by the military. The government's still firmly in power. They're just utilizing the military strong arm to enforce these very scary draconian rules. And these fines are they're ridiculous. You want to exercise your basic human right of movement, you're going to be slapped with thousands of dollars in fines. which I'm pretty sure, though this is Australia, not the United States, we have our own little thing. The metropolitan area that I am close to in the Midwest, if you're not like wearing a mask, it's $500 fine for that. We have a little amendment, the 8th one, where there's no excessive fines is not supposed to be paid out. I think specifically to the federal government. I'm sure they'll subvert that because the states or the local government will get all this money, but it's inherently messed up. It's morally wrong to slap these fines on people that are just trying to live their lives, and having the military rolled out to literally check on people to make sure you're not going anywhere. What part of anything that I just said really sounds acceptable? But to be sure, aggressive and thorough contact tracing and case follow-up have successfully contained outbreaks in countries like Germany without a centralized quarantine strategy, but these places relied on an army of efficient workers hunting down every chain of transmission, a resource not many governments have had time to build up. The classic practice in public health is to identify, trace, and quarantine, said Yang Gonghaon, former deputy director of the Chinese Center for Disease Control and Prevention. But how that is carried out depends on popular sentiment and the country's resources. But there it is, folks. I mean, that is the most disturbing display of propaganda that I've ever seen. They're going to try to normalize these lockdowns. They're going to normalize people being ripped out of their home. Maybe they'll first make it, voluntary. If you test positive, all these people testing positive that are fine, come in. We have these nice, cushy facilities. But then as the cases start to swell, the healthcare system starts to get bogged down with people that aren't really all that sick, but we're trying to completely obliterate the spread. Well, there's still people out there that are spreading this virus. We need to bring in everybody that tests positive. They're already trying to make mandatory masks a thing. Soon it'll be mandatory testing, then mandatory vaccinations, but then it's going to be a yearly vaccination. It's not going to stop until we stop it. And that is something that everybody needs to realize. There is no magical potion that's going to fix all this. There is no, superhero that's going to fly in and save the day. It's actually going to take work. It's going to take talking to people, and it's going to be a hard-fought battle, but it needs to be fought. Otherwise, you're going to have somebody at your door trying to take you or your loved ones away. And nobody wants that. And if you do, this video is obviously not for you, then all hope might be lost for you. But I hope you enjoyed this. I hope you spread this article to anybody and everybody that would be interested. This is the future if something is not done. But I hope you enjoyed this episode. Please like, share, subscribe. Anything and everything that you can do to help support this show is greatly appreciated. Please follow us on Facebook, Twitter, Minds. We're on YouTube. We're on BitChute. We're on Library. Please search us out and share, if not this video, the articles, the actual material that we are reporting on here. The word needs to get out. As always, thank you very much for listening. I'm Lucas Tietzen of Blues News Media, and if you take one thing away from all this, hopefully it is this: ignorance isn't bliss.